I'd like to introduce Michael Durchslag, who is the director of P.E.A.S.E. P stands for Peers Enjoying a Sober Education, and he is actually going to talk about some of his experiences working at the school, and maybe some others. Thanks.
Thank you. As said, my name is Mike Durchslag. I'm the director of P.E.A.S.E Academy. P.E.A.S.E is an acronym for Peers Enjoying a Sober Education. We are actually the oldest recovery high school in the country. There was a couple that started before us in the East Coast, but closed down after a couple years. We started in February of 1989 as Barb Schmidt was the founder of this school. I did not get there, was not there at the beginning. I started working there in 1995. I taught social studies for 11 and a half years, and then in January of 07, I became the director of the school. I'm passionate about recovery schools. I know that when Barb Schmidt had the idea about a recovery school and what it was about, she saw a need that for adolescents coming out of treatment, where were they going? And before this in Minnesota, they're going back to their, shouldn't grab my water, they're going back to their home school. And that makes it very difficult. I present with a guy by the name of Scott Washburn. He's the assistant director of Augsburg Step Up program, which is a college recovery program. And he uses this anecdote as we asked an adult who was coming out of treatment for their relapse prevention plan, coming out of treatment saying, I'd like you to spend 6.5 hours a day in your favorite bar, 5 days a week, but don't drink, and then go to a meeting afterwards. We look at that as probably the worst recovery relapse prevention program on the face of the earth. But that's what we ask adolescents to do every single day. When they come out of treatment, we're asking them to go back to their home school, which is for them probably their favorite bar. Even if they hate school, it's their favorite bar because that's where their friends are, that's where their peers are, that's where they're getting their drugs and alcohol for the most part. I've read different statistics. On an average of probably about 4,000 to 5,000 adolescents go to treatment every single year in the state of Minnesota. Now, I know that a certain portion of that aren't from Minnesota. I'm not from Minnesota originally. I'm from Cleveland, Ohio, and we used to think about Minnesota, oh, that's where, kids got sent to treatment. It's the land of 10,000 treatment centers, and so we have a lot of treatment. So between 4,000 to 5,000 adolescents go to treatment every single year. We have about 170 chairs in the recovery schools. We've seen a decline in the amount of recovery schools we've had, and part of that is just not everybody's ready. Adolescents coming out of treatment, they might not be ready. They don't want the pain they were experiencing. They don't want the consequences they were experiencing, but they want to use every once in a while. The adolescents that we work with, thank goodness, at least have made a decision today not to use today. They are abstinent, and that's a requirement at any recovery school in Minnesota. So I've been there for a little bit, and we have never asked, when I was asked to kind of give this presentation, we collect a lot of data on our end, but I've never asked the question, is a parent incarcerated or has a parent ever been incarcerated? That has just never crossed my mind. It was just not data that we've ever collected before. But I know, looking at the statistics and anecdotally, that many of our students have had or do have incarcerated parents. It has to. I mean, we look at the genetic and the environmental factors and how many of our people are going into the jails and prisons because of drug-related crimes. We know it's the case. Today, P.E.A.S.E Academy serves approximately 75 adolescents who are in recovery. That's kind of at our max, and we serve in a whole year, probably about to this year, since enrollment is closed, we've had 105 students come through our doors. So many of them have, just told stories about parents who are incarcerated or will be incarcerated. And I know one of the biggest ones is, first of all, when they're in a large public school, 1 in 6 is a huge number. It is. It's just huge. But for an adolescent or for a lot of people, they don't talk about it. They're hidden. There's not something that if I'm at South High or something and I'm looking at all the facades of people that they have these wonderful lives and my pop's in jail, there's just disconnect. And so I don't want to open myself up to that. I know at P.E.A.S.E Academy, there's enough of that population where they might be hesitant at first. Just like they're hesitant at first to talk about abuse, they might be hesitant to talk about violence that they've experienced. But when they open up and share, yeah, my mom or whatever, then they just like, oh, you know what, I know what you're going through. Then there's identification. And I know that for a lot of our adolescents, that identification with other adolescents is missing. They feel alone, they feel isolated. They use, what a better way to connect, easy, quick, quick, easy way to connect at a very superficial level. So at P.E.A.S.E or at others, small schools, that ability to connect and kind of make those connections. The other part about it, I got lost. So they're making these connections. They're not apt to talk about it. I know from experiences, some of our students, they experience disappointment, abandonment. Things aren't going well at home and they're waiting for the parent to get out of jail because I'm gonna go live with my dad when he gets out of prison. That's their goal, that's like this dream. When my dad gets out of prison, I'm gonna go live with him and it's all gonna be good. I've yet to see it happen. And they get this cycle of, again, they get elated, they think it's gonna work, they might even be getting encouragement at home, we might be talking otherwise, and then there's disappointment. And they're hurt, and it's kind of the same cycle of abandonment and other issues that kind of come forward. We're lucky at P.E.A.S.E is that we have small staff. We really truly have about an 18-to-1 teacher to student ratio. Then I'm the director, I have an administrative assistant. We also have a licensed alcohol and drug counselor on staff. And it's been difficult. That comes out of, that has, until this year, has come out of our student dollars, the student state funding. And we've had to kind of shift and pull away from kind of the academics, because they get a fine academic program, don't get me wrong. Most of my students go on to college or university where before they didn't think they were going to be able to. But we had to kind of reallocate resources so we could provide a full-time chemical dependency counselor for our students. This past year, through an organization that I also help with, it's called CORI, Coalition of Recovery Investments, worked very strong for a couple things. One was the Good Samaritan law, where I don't know the drug they call it, like someone has an overdose, Steve's law, thank you, where someone has an overdose that more people can carry the antidote. The other one is if I'm with my friend in the ODs, I can drop them off at the hospital without in fear of incarceration or call 911. I knew someone would know more than me. It always happens because I'm an educator, and so some of this other stuff doesn't. But the other part about it is we were able to get legislation that provided additional funding for us, the schools, recovery schools, the specific recovery schools, and there are 4 of us left in Minnesota, to provide the money that we need to provide for LADCs, licensed alcohol and drug counselors, and we used additional money for a social worker. Because that's a needed part of our school. It was a hat that our CD counselor has had to wear on top of a lot of other hats, but it's been really nice to have a full-time social worker on staff now, because she is able to provide a lot more of those services, temporary housing. Because a lot of our students, 25% of my students this year have been homeless, right? I looked at these statistics, 30% of my students have had IEPs, special education. All of them qualify for 504s, right, because they're chemically dependent. I stay away from addict and alcoholic. I just talk about chemical abuse, and I know on the DSM-V5 they all have chemical abuse. I'll let them identify whether or not they're addicts or alcoholics. But for them, I do know they have abused chemicals. So the social workers provide a needed element in our school, and I'm so grateful to the legislature from Minnesota who provided that. So this year when we got together with Corey, they asked me, so Mike, what do you think now? Where do we move forward for the schools? I said, wow, there might be some good tweaking of the law, not to use any drug references, changing the law just a little bit to kind of loosen up some of the funding because it's pretty limited. But what I would love to see, LADCs back into the public schools. If I talk about 4,000 to 5,000 students going into treatment every year, most of them are going back to the public schools. and are receiving no wraparound services. When P.E.A.S.E Academy was at its fullest, it was when more schools had LADCs, because they're the ones who are trained professionals who can identify if there's a problem. They're the ones who can say, you know what, yeah, why don't we try you coming back to this high school? We'll build these extra supports around, but we can intervene quicker if it's not working and get them back to where they need to be. And that's usually more treatment, which is okay, that's not one time and everything's great. I know that we would like to think that, but it usually takes a couple. Most of my students have gone to 3 or 4. I should also mention approximately about 88% of my students this year, it's 87 and a little percentage over that, 88% of my students do have co-occurring disabilities as well as chemical dependency. So having LADCs back in there, so just to provide LADCs, I also said part of this should be more social worker. Really the kind of the social workers that they're overburdened in the high schools, but they also a lot of the school psychologists and the social work. It's for specific needs of students, IEPs. The IEP says they get an hour of social work a week. The school psychologists, they're trained for the most part, and there's some very good school psychologists out there, do not get me wrong, but a lot of them, their focus is doing all the testing needed for IEPs. There's a lot of it. But what they don't have, what our students don't have access to, is kind of that mental health. Danielle, the young woman, she mentioned about having adults in her life. I know that's something that for P.E.A.S.E Academy, what I tell every single student who goes through the enrollment process with me is my hope is that you can find an adult here, at least one, that you can start sharing with. So I think it's really important for anybody to kind of be able to share and start opening up so we can support them as they move forward. I'm not, we can't, sometimes it's not about like, oh, I can fix that. Most of the things I can't. Most of my teachers can't fix, but it's just listening, and if they need additional resources, how to get them those resources. I think our schools are overburdened. I believe that we need to put more of those kind of mental health, licensed alcohol and drug counselors and social workers in there to be able to listen and resource them out. So, covers enough. So thanks for letting me be here tonight.